I'm Andrea Riposati, CEO and co-founder of Dante Genomics. My background actually is not in genomics. I studied business and economics, did an MBA at Harvard Business School. The driver to move into the genomics and healthcare industry was really the realization that there is a massive opportunity to bridge the gap between science and availability of solutions for patients. And so that's why we founded Dante Genomics, to really enhance that clinical utility of the genome and enable millions and hundreds of millions of people worldwide to get the benefits from analyzing their genome and getting the best interpretation. Today, Dante Genomics has about 50 employees worldwide, and we have sequenced the genome of more than 60,000 people worldwide, enabling individuals from Europe, the United States, or even remote islands like the Marshall Islands or French Polynesia to get access to their genomic information and to receive personalized reports based on their medical history. Today, about 80% of our sample volume comes from research and clinical organizations in Europe, North America, and really worldwide. Then the remaining 20% comes from individuals who are interested in sequencing their genome for medical reasons or because they have a family history of a certain disease. Right now we are sequencing like tens of thousands of new individuals every year. When we choose our sequencing manufacturers and as a supplier, we value, number one, the quality of the instrument and the reagents. And I think companies like MGI have been around and have been sequenced like millions of samples. So you can really see from the instruments the expertise of the company in terms of very high quality results. We have had a very good collaboration with MGI. The relationship has been great. We started our collaboration with MGI actually in 2020, but limited to lab automation. And then in 2023, we expanded the collaboration to sequencing by acquiring the first MGI T7 in our Italian laboratory. And since then, we have expanded the collaboration, which now includes also single cell sequencing and also spatial. In fact, we have also developed some new proprietary tools customized exactly for the MGI T7 and the MGI technology so that our lab can use more automation, software-driven automation, to really enable the MGI T7 to give its best performances every time we run a flow cell. MGI today is a great company and is developing new and amazing technologies, not just in genomics, but also in omics and many more areas of healthcare. So I hope that MGI keeps pushing the development and releasing new and new products every year, which we can use to really expand access to the benefits of those technologies. And if you think about the future and what's already happening today is that unfortunately today the benefits, a lot of high-end genomic solutions or multiomic solutions are not available for patients through the standard healthcare systems or through government healthcare systems. And so what's happening is that many patients, many people are now turning into private healthcare systems or online. They take healthcare in their own hands using online e-commerce solutions like the ones that we offer. And so the future will be really a future where in the end patients will have more choices. And by having more choices, it means that they will have the choice to receive an advanced whole genome sequencing solution from their own government healthcare system, from a private clinic, or as a private consumer buying it directly from the lab or the provider. And as such, the costs will go down, the benefits will increase because more and more people will have access to more and more reports and more interpretation. And then the cost will be lower for them. So there will be this mixed private-public model where reimbursement will play a role, insurance companies will play a role, concierge clinics will play a role, manufacturers like MGI will play a role, companies like us will play a role, and we really see Dante to be the enabler, technology enabler, to connect all these different players and in the ecosystem. In the end, just giving more and more solutions to more and more patients worldwide, and also increasing the number of patients that can really get access to the benefits of multiomics. Today, there are technologies where there are simple sample collection devices where you do not need to go to a lab or to a hospital to get your blood drawn. which is great because in a big city like Shenzhen or New York or Milan, there are big hospitals that offer genetic solutions. But if you think about a village or a small town in the countryside, that person now, thanks to online, does not have to take a train or to drive a car for hours to go to a big city. And so that person can receive high-end technology and high-end quality technology solutions at their home. In fact, if you think about also, let's say, famous people who sequenced their genome or took a genetic test, like Angelina Jolie, for instance, famously took BRCA1, a breast cancer test, and I think at the time she paid something like $25,000. And as you know, the breast cancer test only sequences 2 genes. So today, with whole genome sequencing, you can get access to whole genome sequencing like the Dante genome for hundreds of dollars, not 25,000. And so if you think about it, today, everyone in the world can get access to a way superior technology solution in genomics than what Angelina Jolie did, paying way less. And this is real progress now. This is real progress where you do not need to be famous and rich to get access to these great benefits of genomics and multiomics, but really everyone in the world from a small village with a relatively small investment can get access to technology solutions that are superior to what famous celebrities paid just a few years ago.